Hi everybody, Friday evening, live from my quarantine office. So I've been getting a ton of questions lately as far as the antibody testing that we are doing in the office. So I thought I would hop on here and answer them very quickly so that then I could just send this video to anybody that has the same question. So we are using a lab called US Biotech. They do a lot of our different testing. They are processing the test in-house. They did not create the test itself. It's actually created by a company called Diazamine, which I think is actually providing tests to a lot of different labs. However, the reason I went with US Biotech is because they are processing the results in-house. And I'm familiar with them and I trust them and I like the way that they work. The test that they are doing, this is an antibody test. This is not the fast result test that you can go to your physician or urgent care or whomever. This is a little weird, and get results to see if you have COVID-19. This is an antibody test to see if you either had it or were exposed to it and maybe were asymptomatic. This current test is a serum test, so they do take blood. They take 1 vial of blood. It is spun down, and then it's tested to see what your antibodies look like, if they are there. This test has 96% specificity and 98% sensitivity. So what that means is, are they testing for what they say they are testing for, which is the COVID-19? And is it coming up? So if someone was tested positive, so let's say that you are symptomatic, they test you for COVID, you have COVID. The real way to do it is to actually test you 24 hours later and see if that second test comes up positive as well. So if that comes up positive as well, then yes, you are labeled with a positive COVID-19 diagnosis. Now, the antibody test is then given to those individuals, and I think their sample size that they ran in order to see what the sensitivity and specificity was on this test was like 225 people. So these were people that were confirmed positive. And that's how they got up with this 96 and 98% numbers. It is recommended that anyone that is over 65, so they consider that a senior, anyone that has worked or been in contact or been a resident in a nursing home or long-term care facility, anyone with chronic lung disease or asthma, obviously those people are at much higher risk for having higher complications from COVID. Anyone with severe obesity, so anyone with a BMI over 40, it's recommended that they are tested. Anyone with comorbid chronic inflammatory diseases. So if you have a chronic illness that you are currently chronic, obviously you had it for a while, it's not going away anytime soon without any real interventions. You should be tested. Anyone that's immunocompromised, anyone pregnant, anyone that smokes, again, this is a disease that attacks the lungs, and healthcare workers and first responders. So those are the individuals that are primarily recommended that should be tested. What else did I want to cover with you here? So what does this test do? So this tests IgM and IgG antibodies. IgM antibodies are the ones that come up. They respond the quickest at time of infection. So if you are taking an antibody test and your IgMs are elevated or are still elevated, then that could mean that you're at the tail end of the infection. It could mean that you currently have it, but you're asymptomatic. So those are a few things that you want to pay attention to. That's why I would recommend running this test through a provider. Because if you just run to a lab and they hand you like a piece of paper with your results, what are you going to do about that? You're going to have to figure out not only what they mean, but then what interventions are necessary. What do you need to do? So make sure that you're having this run through somebody that you trust. IgG is what shows up later. So IgG is what they're basing their thoughts of immunity off of. So IgG, if your IgG is reactive, that means that you've started to, your IgG levels are increased. So you had the infection, you're starting to create these antibodies against it for the next time. Now, again, this COVID-19 is way too new for them to have any solid data or solid recommendations. So when people are watching the news and seeing that testing is not FDA approved and testing is not reliable, testing is reliable. It tests for what it says that it tests for. What they are unsure about is if you have these IgG levels, what does that mean as far as immunity? Does that mean that I could go, run through the hospitals and not need a mask? And if I'm around people that have COVID, I'm not going to get it again? No, that's not what this means. What this means, and they're basing this off of the other types of SARS infections and how our human body responds to the other types of SARS infections. So what it means is that if you have these IgG antibodies, if you were to be exposed again, or if you were to become infected again, that the response that your body has would not be as severe as your first infection. So for a lot of us that are healthy, that do not have these comorbidities, that do not have obesity rates over 40, do not have BMI over 40, then for us, if we were sick or if we were ill, and the individuals that I spoke to that fall into these categories, even some with comorbidities, they were sick, but they were at home and they recovered relatively well. Their subsequent infections would not be as bad. So that's what this means. So we recommended testing so that for most individuals, it's about peace of mind. So were you infected? Were you exposed? Did your body start to mount a response? And do you have antibodies for any other additional infections? That's what this is about. We are offering it at our office. If you have questions, there's a previous post in my bio if you want to know more. It's $225 and it is $95 per individual or per family. I've had a lot of people that are testing 3 members of the same family. So it's $95 to our office, and we will go over the results with you. We will give you a game plan of what the results mean one way or another. What should you be doing if you've had the infection? What do you need to do to appropriately heal from that? And what are some options that you have to boost your immunity if you have not been infected or you are not reactive for antibodies? So you are not mounting a immune response. What needs to be done in that scenario as well? And we are donating 50% of my fees to Twice as Nice Mother and Child, which is an organization that both Dr. Jade and my mother are on the board of directors for. So if you're unfamiliar, they provide diapers and wipes and other necessities to families in need in Lake County. And unfortunately, due to hoarding and due to the increased unemployment rates, that need has increased exponentially. So we want to do something to try and help them out. So 50% of my fees collected are going towards that. So if you want to be tested, if you want to help out, put some diapers on some babies in Lake County, then see our office. There's lots of people all over the state that I'm aware of that are doing the testing. I'm mailing kits to other chiropractors so that they can test themselves, so that they can test their families. Oh, and we are also doing, because this is a blood draw, and this is a little bit different than what we had anticipated initially, but I'm hiring a phlebotomist to come into the office, and we are going to do blood draws complimentary to anybody that wants to do it at our office. I just thought that would be easier. I'm trying to make it as simple on everybody as possible and as safe, keep things as safe as we can. So if you have questions about that, feel free to drop me a comment on here. Share this video if you have individuals that you have discussed getting tested. Again, if you don't hear from me right away, there's a lot going on and, a lot of questions that we've been answering. So I was hoping that this video would answer them. And if not, maybe I'll do another one. So have a wonderful evening. Love you all. Stick it out. If you're feeling stressed and you're not in my stress management boot camp, shame on you. So go check out Dr. Jordan's stress boot camp. We have some awesome stuff. I have some really kick-ass guests coming up in the next couple of weeks since we're stuck inside for the next month. So if there's anything that I can do to be of assistance, feel free to reach out to us. We are still open at our office seeing patients, and we're doing a lot of physical therapy virtually. And of course, all of the functional medicine that I do is still going on virtually all across the world because everybody's dealing with this. So have a great evening. Anything I can do to help, reach out. You know I'm here. And take care of yourself.